There you go. Good morning, everyone. Welcome to I believe it's our third presentation and of updating our fellow childcare providers on the Nurture Benefits pilot program. I want to introduce myself. My name is Michelle Beebe. I'm the Chief Revenue Officer for the Small Business Association of Michigan, and I'm also the lead on the project for Nurture Benefits in our partnership with the state of Michigan. With me this morning, I've got two of my coworkers here that will be here to help answer questions that come up in the Q&A. We will have the questions and answered Q&A live during the whole presentation. So my goal is to answer most of your questions as we go through, but if there isn't things that were covered or you have questions as we go, Brianna Schumann, who is a member care coordinator for the Nurture Benefits team, and Kevin Concannon, who is the manager of the member care team here at Nurture Benefits as well. And they're both here meeting the Q&A to keep me on the straight and narrow as we have our conversation this morning. This presentation is also going to be recorded and you will receive a copy of it after the fact. So please don't worry about having to take notes as we go, that the recording will be provided as well as a copy of the slide deck. With that, we're going to get started. So first of all, I think it's just important to talk about what is Nurture Benefits. Nurture Benefits is actually a MIWA. A MIWA is a Michigan Multiple Employer Welfare Arrangement Program. And I'm going to affectionately call it a MIWA through the rest of the presentation. It's a big fancy word for a legal entity that provides a unique way for multiple employers, so all of you from the same industry, to be pooled together to offer employee benefits. A federal grant has been awarded to Nurture Benefits for a 2-year pilot designated and designed to help Michigan licensed and licensed exempt child care providers access to affordable employee benefits, including health, dental, vision, life, disability, and retirement benefits. Nurture Benefits is a limited liability company, and it is a subsidiary of the Small Business Association of Michigan. What is the most important thing, I think, for you to know is that the board of this of Nurture Benefits is made and consisted of child care providers throughout the state of Michigan. So we have different excuse me, types of providers and geographic providers that are representing and making decisions on your behalf and on the behalf of the MIWA. There's a lot of legal entities and requirements that need to happen, and we need a governing board to make those decisions. There's also a lot of compliance that's required with the state of Michigan to meet all of the standards that are necessary to offer a MIWA. And why does all of this matter, and why are we doing this? One of the biggest key factors that all of you are facing, not just childcare providers, but all small business owners, but specifically in the childcare industry, your margins are very narrow. And we know the ability to offer employee benefits continues to be a challenge, especially in a market where keeping talent and retaining talent continues to be a significant factor on providing quality care for our children. So only 35% of childcare employees currently receive health care insurance through their employer. This is based on survey data that we've done ourselves and that has come directly through the Michigan MyLeap department. And as I mentioned, you have, I'm preaching to the choir here, financial burdens, slim profits, lack of affordable employee benefits, workforce shortages, wage disparities, and administrative regulatory complexities, especially in your industry, and then to be competitive for talent, as I mentioned. And then kind of how did SBAM get here, right? And how did the state and SBAM start to work together? So the Small Business Association of Michigan is a 50-year-old plus statewide association that is focused on a very simple mission, the success of Michigan small business. And most child care providers fall into that category. The category that we use to define small business is less than 500 FTEs in the state of Michigan. The reason why the state of Michigan contacted us and started to ask if this would be something that we'd be able to help facilitate is that at least in those 30 plus of those 50 years, we have been providing and have a subsidiary called the Small Business Insurance Services um, Corporation, and that arm of SBAM is completely designed to offer employee benefits in a third-party administration function for health and life. We provide consolidated bills and COBRA administration for small business owners. And that team, as I mentioned, Kevin and Brianna in the beginning, they are members of that team, and we have licensed insurance agents that are also able to help support you with your decision making and any kind of consulting or anything that you would need to make sure that your business is compliant in that employee benefit space. Because we all know that that's not your expertise, right? Um, Background, kind of a little bit about SBAM and the MyLeap partnership. MyLeap awarded SBAM part of the PDG 5 grant to help make childcare sector more attractive for talent and to promote worker retention. These grant funds are being used to create the benefit platform. There's a lot of work to create the MIWA, legal requirements, staffing that's necessary, and then to work with and provide work with insurance carriers to provide insurance premiums, and then to not only do that, but to build a formula for the subsidy in making sure that those funds are being used in the way that they've been designated by the federal government. And again, you're going to hear me, I'm a broken record. The whole goal is to provide access to affordable employee benefits for child care providers throughout the state. The governance and structure is very specific when you're working with a MIWA. We have 6 child care providers that are on the board. As I mentioned, if you go to the Nurture Benefits website, you will see the members of the board there that are represented. And then we do have one liaison from the staff here at SBAM that is there to do more of the execution of the decisions that are made by the board, and that person is myself. And so I do sit on the board and really help educate, bring the necessary items to the board for decision making, and then execute on what those decisions have been. One of the key things that we've been focused on since the coordination of Nurture Benefits is looking at different plan options, reviewing those plan options, picking the benefits, and providing approval. You could ask a lot of different ways about why did we go this route, and why we decided to offer a MIWA versus some other options that we could have done. Was a MIWA really allows for all employers, regardless if you're a sole entrepreneur, all the way up to a center with maybe a couple hundred employees, a level playing field on being offered the same benefits regardless of your size, and it neutralized the cost. So those of you that may be paying age banded rates or experience rated rates, depending on how your plan is designed, it levels the playing field in that capacity, and everybody is in one giant pool, and all of the employees are in so it's kind of like GM, for instance. So all of their employees are in this very large pool, and the bigger the pool gets, the more we have the ability to provide claims experience as a group and be able to have some buying power when we're talking to carriers and set our rates. So this first year, when we start to talk about rates, it's really important for you to understand that the rates were really established in the actuarial's best guess with the insurance carrier, because we don't have enrollment today. So all we had to work with was what we knew was how many potential employees we have that are eligible for the benefit, and then making an educated decision. The insurance carrier did that part of it, and set the rates based on what they believe to be the best scenario for this first year. But after we get through that first year, then we really have some buying power to negotiate rates and benefits that are best for that on behalf, because now we've created our own pool and we have buying power. A few things that I want to make sure that you're aware of is the pilot is officially going to launch on November 15th. And what I mean by that is we will be open for business. So the things that we talk about today in this meeting, all of the portals will be live. We'll be able to take applications for enrollment and be able to start your specific business's open enrollment if should you decide to go down this path. The first eligible effective date is January 1 of 2026. But I want to express that maybe you have a renewal that's, July or September or whatever. You don't necessarily have to make a decision to move into the plan effective January 1, but that is when the benefits are first eligible. But you could enroll on February 1st, March 1st, it doesn't matter. The rates will be the same. They're locked in for a 12-month period, and you can make those elections at any time throughout the year. But first, November 15th is an important date for you to remember should you want to enroll for January 1. Benefit eligibility. This is a hot topic and I get a lot of questions. The eligibility is set by the state of Michigan and the Nurture Benefits Board. You have to be have an active and approved license, or be a licensed exempt childcare provider in the state of Michigan. You have to have your employees have to be working 30 or more hours a week. And if they're a new hire, they'll be eligible 60 days following their date of employment. Again, I mentioned this earlier, it doesn't matter what type of center you are, center-based, family home, or group home. We've had a lot of questions about, well, what if you're part of a public school? Again, the eligibility requirement is you have to be an actively licensed or licensed exempt in the state of Michigan. And I think what's really important here is this is an employer-offered benefit. So the decisions are going to be made by you, the employer, when we're offering benefits in this coverage. So it's not going to be something that's just open and your employees can pick and choose. If you decide as an employer to offer these benefits, it was really important for us, for the employee to recognize that these benefits are being offered to you. It's a benefit of being an employee of your organization, and that the decisions that are being made on what's being offered and how they're being offered is made by you as the employer. Again, we can go down to one in size if you're a sole entrepreneur and you have a family home provider. Dependents are eligible. So if you have employees or yourself that have dependents that are the college age, 19 to 25 or 26, they are eligible for benefits. And those benefits end on the calendar year of your child's 26th birthday, or if they're eligible for benefits through an employer in a sooner time. Domestic partners. This has also been built into the plan so that if your employees or yourself has a domestic partner and you're not legally married, that you would be eligible to offer benefits in this capacity as well. So one of the biggest questions, right, is who and how who's going to be subsidy eligible. So one of the things that I think is important to understand is that while the state has set aside a significant amount of money, $1.8 million for this first year to provide subsidy, that actually doesn't go very far, which is the sad truth about how expensive healthcare is. But that subsidy is eligible for 400 that amount allows for 484 employees to be eligible for benefits through the employer plan. And that subsidy is going to be 50% of the base plan for the PCP Focus Network. So 50% of the single rate for the health, dental, and vision rate. And how we're going to determine who's eligible for subsidy is it's going to be a weighted lottery system. Providers receive points based on the way that they attest to an attestation form. And I'm going to talk a little bit more about that in a minute. Depending on what those questions are, each point allows for you to have an entry into the lottery system. So the more points you have, the more you're in the lottery system, but everybody gets points to be eligible in the lottery. We also are going to make sure that county level data is also going to have some weight in this, that we want to make sure that we're having equal representation and eligibility throughout the state of Michigan. And then there's going to be a subsidy application. So some basic information, owner demographic information, business name, federal ID number, your license information, so we can confirm with the state that you are a licensed provider in good standing, the county in which your business is in, or you might have multiple locations. So the multiple counties that your business is in. Phone, email demographics, the number of employees that you have that are being offered benefits that would be eligible for benefits that work 30 plus hours, as well as those that work 30 or less hours. Um, how you offer coverage today. Do you not offer any? Do you offer it, but you don't contribute? Meaning that, hey, I do have a group plan, but because of the cost, I'm not able to do a cost share. Or I offered and I contribute to the group health plan. And if you do happen to be an employer that offers coverage, if you could share the name of that carrier, that would be very helpful. And then also want to know if you're offering it to all employees, or maybe you're just offering it to a segment of your employees. Maybe you're just offering it to your lead teachers and not, your aides, different classifications, or maybe you're offering it to them, but you're not contributing the same, some of that information. There'll also be an electronic attestation stating that you have attest to this information as being accurate, and therefore that information makes you eligible to be put into the lottery for the subsidy. Another important piece of this is also an employee census. So those that would be eligible for benefits and those that are not. So we'll need a complete census, and we will have all of these things available along with a checklist on November 15th. So you know what you need to do to complete this and get you in line for the eligibility for the subsidy. Sorry, I got an itchy nose this morning. I don't know why. One of the things that I wanted to just touch base on, I know that this is a little small, and I can make it a little bigger, I think, but wanted to share with you the three base plans that we have that we're offering through Nurture Benefits. There's a base plan. It is an HSA high deductible plan where benefits are offered after deductible has been met and then covered at 100%. One of the things that I do want to point out, though, is preventative services are covered, and they at 100% outside of the deductible. Then there's a mid plan that does have some fixed co-pays that are for office visits, and then deductible for some diagnostic and hospital coverages. And then a high premium plan, which is the premiums are going to be higher, but it's a richer benefit. So as an employer, as I mentioned, and we'll talk about rates here in a second, is that base plan is where the subsidy is going to be applied based on the rates of the subsidy. But it doesn't mean that you can't choose as an employer the mid or high plan to offer to your employees, but the same amount of money for the subsidy it's not going to change. That's a fixed amount based on the premium plan. But if you decide to offer the mid, that money still is going to apply. It's just going to have a bigger disparity on it being a 50% coverage. We also have dental and vision. This was something that we really heard from you about in your surveys, that your people currently are not offered, in most cases, dental and vision benefits. These are actually pretty solid benefit offerings. They're very inexpensive. If you wanted to offer these, you can offer these as a standalone. So if you didn't want to go with the healthcare options, you are eligible to enroll just in the dental and vision for your employees. And again, I'll show you pricing here in a second, but they are incredibly cost effective for you to have at the very least, offer these benefits for your employees. One of the things that I wanted to make sure that I touched on, I know many of you are probably familiar with this if you are offering a group health plan, but all of the plans that I mentioned before, the basic, mid, and high plan, all have comprehensive behavioral health and mental health benefits. So I know you're in a very stressful industry. There are times of the year, especially that things are more stressful than not, and wanting to be able to offer those types of benefits and solutions to your employees. We heard from you that that was really valuable. And we have some teledoc um, capabilities, mental health wise, and in-person benefits. And all of those plans are included with that. Now, the $1 million question, right? What's the price? So wanted to share with you, I'm going to try to make this a little bigger so you can see this, what the base premium prices are. So for a single, it's $582 at the base. This is the 50% right here in this light blue section. This is the 50% of the single that the subsidy will be applied to from the state of Michigan. So 50% of the 582.66. And then this is the rates for the double and the family. And again, 50% can be applied towards the double in the family. And then the employer, but it's only going to be of that single rate. And then the employer can choose to contribute to a higher contribution should you choose to. Here is also the single, two-person, and family rates for the dental PPO and for the vision. As I mentioned, those are very reasonable rates. And some of you might be like, "Oh gosh, this is way more expensive than I anticipated." And I wanted again to touch base on these rates are based. They're the same for everybody. So regardless of how big or small you are, these are the rates. It doesn't matter how old you are, these are the rates. These rates were based on a picture that our partner, Blue Cross and Blue Shield and Blue Care Network, made the decision that they have a whole actuarial team that makes a decision on what the risk factors are and what we don't know, right? We don't know how many people are going to be participating in the program, how many are going to be enrolling that have never had insurance before that might drive our claims up. How do we contain the risk and not blow up the pool in the first year and make sure that we're building something with long-term stability? And so these rates are based on their best guess, based on what we know and who we know that are eligible for benefits. And next year, when we have a renewal coming up for January of 27, then we have an actual picture of who's enrolled, what our claims experience is, and have the ability to actually negotiate our rates and have more conversation about what our experience is. But right now, we're an unknown. So that's how these rates were established. Life and disability. I'm going to have more information on this week. So please keep your eyes and ears open on all of our websites, and I'm going to go over that towards the end. But we are partnering with One America Financial. We do have a life product, disability and short-term and long-term disability product that your employees will be eligible for should they want to enroll. This is not an eligible subsidy product, but it is relatively inexpensive to offer this benefit to your employee. Especially, I know some of you were very interested in being able to offer short-term disability to your employees. And so it is a 100% participation. So if you do offer it, those that are eligible, you do need, if you're under 10 in size, this is under 10 in size, that you will need 100% participation. And again, we're going to be putting some literature and details on this and make this available for you this week. This one is kind of hot off the presses, and I appreciate your patience as we are still building some of these things as we march towards November 15th. The other product that I mentioned that we are offering is a pooled retirement 401k program. So this is unique. This is a benefit offering through a partner of ours with Transamerica. So Transamerica is the underwriting fiduciary for the 401k benefits. And then we have a partnership with Greystone Consulting that is They are a small business themselves that help with the enrollment and decision making for the 401k retirement program. This one of the key features is that this, like as I mentioned, is a pooled plan. So it treats multiple employers as one large group. So we benefit the more of us in the pool, the more money we make, because the pool is combined together. It's sponsored by and includes independent fiduciary oversight by a pooled plan provider. So we have an outside fiduciary that is making sure that we meet all of the administration and oversight. And then there's one combined 5,500 in a single audit for the PEP. So if you're of a certain size, you may not have to file a 5,500, and this will be filed for you. If you are larger and do need to file the 5,500 as a business entity, there's a reduced audit benefits cost and compliance, and all of that is handled through the program for you and built into the plan. So I know this was actually one of the areas that I was a little surprised about. We already had quite a few employers reach out to our partners and are very interested in signing up in this. So again, you don't have to take any of these together. You can just do life insurance. You could just do dental insurance. You could just do the 401k. But we wanted to make sure that we offered a full comprehensive benefit package that you could offer to your employees. You also don't have to do a match with the 401k. So there's a lot of flexibilities and some tax advantages if you've never offered a 401k before as well. One of the important things for you as the employer as we move forward is to create an online account. So here's a link right here. My friend Brianna will put a link in the chat as well, so you can click on it directly. And this is our service help desk. This help desk one, it allows for you to create a ticket at any time to talk with a representative. It immediately gets assigned to a member of the Nurture Care member care benefits team, and will connect and answer any of your questions. It also has all of these documents that I'm referring to, like more details, like if you want to know more details on the cost of things, more details about the plan design, all of those things are available on this site. And so I really recommend at the very least to create an account and make sure you have access in this system. November 15th or later is to complete the employer attestation form. Nurture, kind of what will happen is after you've completed that attestation form, the Nurture Care Benefits staff member will walk you through make sure that you've been eligible, put you in the lottery for the subsidy. Then they will communicate with you and whether or not you've been subsidy eligible, and you can make a decision if you want to move forward. And then if you do want to move forward, they'll send you access to the benefit portal. And the benefit portal is just that. It's going to allow you, everything will be done electronically. You'll be able to go in, make your decisions, set your contribution amount, and allow for you to decide which plans you want to offer, whether it's life and disability or if it's just dental or vision. And then once you've made your decisions, then you can send in an invite to and complete your enrollment paperwork. Then we will help you walk through sending an invite to all of your employees. Then it becomes kind of a shopping experience for your employees to go in, pick which plans that they're interested in, and allow them to enroll. And then from there, a member of our team will validate this information, make sure that it's updated and loaded into all of the appropriate carrier systems, and you will receive confirmation that this has been complete. And you will also, one of the things that may be different for all of you is because we are considered a MIWA, we are one large account for ERISA requirements, and that makes all of your employees COBRA eligible. So part of the program and part of the offerings that Nurture Benefits is taking care of for you is making sure that you're COBRA compliant, making sure that all of your paperwork and information related to your employees that are COBRA eligible is taken care of for you. So it's free of charge. You have Cobra administration in this program and your Cobra paperwork. So there'll be some paperwork that you'll need to complete in that space as well. And then, as I mentioned, we have a member care team. You'll see actually if you go to the website. So I'm pretty sure I can't see the chat right now, but I'm hoping that Brianna can put both the website and the nurture care service site there. We have a dedicated team that's specific for nurture care benefits. Their expertise is going to be supporting this program. We'll be taking care of helping you through navigating, getting online, and we're not going away. So if as you add employees, terminate employees, we're here to support and take care of that maintenance or even those life events that, somebody gets married or has a baby or all of those things that take place in someone's life to help support you throughout the year. We'll also be providing compliance because as an employer, you should be providing summary plan descriptions and all of the COBRA compliance. This is also just for you to have this for your records. The phone number to reach the Nurture Benefits Care Team is 517-594-4355. And then, as I mentioned, we have these live portals. You can submit tickets. You can pull down your plan information, add optional benefits if you want, and manage any billing and contribution. So you will be receiving a Nurture Benefits electronic bill. So bills will be paid electronically and submitted to you electronically. If you are subsidy eligible, your bill will be, the subsidy will show on your bill, and the Nurture Benefits team will take care of collecting the premium that you are responsible for as the employer, and then collect what's needed for the subsidy and disperse all of the correct premium dollars to the carriers to make sure that the carrier is paid in full. So we will be managing all of that on the back end, the billing and the contributions. But in order for benefits to stay active, you will have to maintain an active bill on your side and for employer contributions. And then, I think the biggest thing that I cannot stress this enough. We're hoping to continue to raise more funds throughout the year. We're working on that right now behind this to add more to the 1.8 million subsidy pool. And in order for us to make this program long-term sustainable, we need to be strategic about it and not necessarily rely on federal grant funds, but to make it independent here in the state of Michigan and raise our own funds. Many of you have relationships in your area that or partners that you may be interested in providing funding towards this program. If they are, please let me know. I would be happy to reach out and talk to them about what's involved if you have a donor that is interested in contributing to the subsidy. As we get more funds in the program for subsidy, we will be offering it to more people in the lottery. So this isn't a one-time, our hope is that we can continue to add funds all year long so that more and more people are eligible for the subsidy. We're going to continue to do reporting. We'll be reporting out to you on monitoring and evaluating the effectiveness, who's enrolled, how many people are active, how our claims are being handled, what can we expect for next year. And then we really want you to be informed and have stakeholder engagement and communication throughout this whole process, because it is very important to us that we are building this for you and not building it in a silo on what we think is best or what you might need, but for us to actually build what's best for you and your employees. So there will be a constant feedback loop where we're asking for your feedback and making sure that we're hitting the mark in the areas that are necessary to show success in the program. So this is the time for questions. If you want to add more questions in the chat, let me know. Otherwise, we can kind of hang out here for a minute. and, or I guess I should say in the Q&A section. It's not in the chat. I keep saying the wrong thing.
Michelle, I have a couple of questions that I saw out there that we didn't answer. One of them was, how is the 30 hours per week determined? Is it based on last year? And what happens if somebody falls below 30 hours for a period of time
Okay,
after they're
great.
subsidy eligible?
Yeah, great question. So this is determined on it's a look back period, but basically what I usually recommend is if they're been eligible on an average of 9, whatever their average is for the last 9 consecutive months is would determine their eligibility. Let's see here. What else do we have? What
We
do
have
you
a
mean
few
by
asking, when will we know the results of the lottery?
Our goal is to be able to turn this out within the week of receipt of the application. So hopefully 5 business days is you'll know the answer to whether or not you're eligible for the lottery or not. Or you'll always be eligible for the lottery, whether you're eligible for the subsidy. Yes, you can. I see, is there an instance, let's say the employer wants to pay 50% of the total due for them after the subsidy. Can we take their contribution? Yes, you can do this in a pre-tax basis like you would with their permission, of course. Yes. Yep. They're still eligible for this to be a standard contribution. And just so you know too, I think there was a couple of questions I had in the past where the subsidy is actually being applied to the employer, not to the employee. Because if we apply the subsidy at the employee level, this would become taxable income for them. And that's, I know, a big no-no. So doing it this way and doing it at the employer level allows for this not to be taxable income for anybody. Any other questions out there?
I have one more. What if some provider is determined to be subsidy eligible and all of their staff that enroll are receiving the subsidy and they hire somebody mid-year next year? Will that person be subsidy eligible?
Most likely, no. Unfortunately. I wish I had a lot of money I could give it to everybody, but I don't. Any other questions? I think a lot of these I answered about the lottery subsidy. It's 50% of that dollar amount of the single rate. If you're not fully licensed yet, you will not be eligible. You have to have an active license with the state of Michigan. So the single rate, so I think it's like 3 something with the dental and vision all built in there. I can't remember off the top of my head. I need to get that saved in here. But that amount will apply, like if they're a family or a 2-person, that same $300 will apply. So $300 will go towards the 2-person rate and the family rate, but no more than that. So that will be. Rates that are listed without a subsidy that's a monthly amount, I'm sorry to say. All right. Yes, if an employee leaves and we hire a replacement, that person can take over the subsidy. Yes. I know that there's going to be, you will need to submit an application for each federal ID number. So if you have multiple federal ID numbers, that is considered separate business entities, and you will need to set an application for each business entity. If you're commonly controlled, and I don't want to get into a lot of complexity on that on this call, but if you're commonly held business entity with multiple federal ID numbers, that's a little bit of a unique situation, and we can talk about that offline. Yes, that, if they work just July and August, that is seasonal and they would not be eligible for benefits. Again, the subsidy, we're gonna do our best. Once we received your application, we will let you know within 5 business days. The subsidy will be based on how you answer the questions on the employer attestation form. And each of those questions have some weight in them. And based on the weighting, you will have the more weight in certain questions will give you more opportunities to have an entry into the lottery. But every single application will go into the lottery. Some will just have multiple um, entries. So when it's picked at random, you may have a higher option of getting selected because you have more entries. Um, will it open up? I'm hoping this subsidy will reopen even throughout this next year as we raise more funds. So again, I need your help as much as possible if you're working with foundations or organizations that you know might be interested in providing or donating towards the subsidy. Um, Let me know if you have any interest or somebody that's there. We do have a donor flyer that you can share with people that would be interested in providing additional dollars. So yes, as we raise more funds, we will open up more eligibility for subsidy. Anything else? I think I answered all the subsidy. Um, what we're gonna do is when you send in your census, for your with your attestation form, you're going to be providing us how many employees would be eligible. If you win in the lottery to be eligible for the subsidy, we're going to hold enough enough funds for all of your eligible employees, regardless if they enroll or not. Once they've completed their enrollment, and if we have less um, that take the subsidy, then we're going to put that in the pool to offer to other people. But at the time that you send in your census and you're eligible, we're going to hold enough funds for all of your employees at that snapshot in time that are eligible for benefits. So we're not going to put you in a position where you have to pick and choose which people at the time of enrollment. I'm not sure I understand the question. How do you know how to answer the question to get rated higher so we would be eligible for the discount? Um, oh, I think you're asking about how to answer the questions on the attestation. I I think I just want honest answers in the attestation, and based on those, um, so those questions should be answered honestly, and based on those honest answers, that will determine how many entries you get into the lottery. So we just need that information, and as I said, each of them have different weighting, but um, it is definitely a ethical, um, we're asking you to be a test that you're being honest, that to these questions. So for sure. And again, a lot of your questions, there's a Q&A, and we'll continue to keep adding to the Q&A as questions come in. A lot of this stuff has been answered in the presentation. You'll get a recording of this as well. And you also know where to find us. My email is michelle.bb@nurturebenefits.com if you've got any questions. And But I highly suggest that you use the service portal, get yourself logged in, and the team will take care of you. It's will be the most effective way for you to have service. All right. Well, thank you very much for attending, and you know where to find us if you have anything. And please make sure that you get in. You've signed up for our newsletter. You can do that on our website. If you go to our website, up at the top right-hand corner, there's an option for you to sign up for the newsletters. And I've been trying to send out one once every week, every other week, to make sure that everybody is updated. But I know there's also been some sidebar conversations on some other association conversations on different Facebook pages and all of that. We're not part of any of those things. So if you guys have questions specifically about nurture benefits, or even if you're in a chat on a different Facebook page or any of those things, could you please encourage your fellow providers to either use the nurture benefits Facebook page or to come to this site? Because I know that there was some people had expressed frustration that we weren't answering the questions over there, and it's because we're not part of that group. And so there's a Nurture Benefits Facebook page, but again, we specifically have a help desk that is here to help and answer all of your questions. And it's really important to make sure that that's the fastest and easiest way. But please encourage your fellow childcare providers to use the official Nurture Benefits channels if they have any questions. All right, signing out for today, and we have more webinars coming up this week, and you'll get to see our three lovely faces more in the future. So thank you very much, and take care. Bye.